Let's go first up to Singapore and catch up with Gwyneth, who's senior broadcast journalist with CNA in Singapore. Thanks for joining us, Gwyneth. I took a great interest last week in that opinion piece written in the Straits Times by three of your senior ministers. We quoted quite a bit of it in this program last week. It got a bit of media attention across Australia in the following days. It maps out a clear path to COVID normal. Now, I think a lot of people are thinking that Singapore are doing this right now, but it's more about a plan for the months ahead, isn't it?
Yeah, that's exactly it. It's not really an opinion piece. It's more of, again, like a roadmap for the way forward. That's right.
Now, let's have a look at some of what they had to say. And part of the article, part of the plan says this. They say that the bad news is that COVID-19 may never go away. The good news is that it is possible to live normally with it in our midst. These are the points I highlighted last week. And they went on to say about various points. But one of the key ones where they said that instead of monitoring COVID-19 infection numbers every day, as we do in Australia, they're going to focus on outcomes. How many people will fall very sick? How many are in intensive care units? How many need to be intubated or given oxygen? And, of course, how many people die? These are the numbers that matter, aren't they, Gwyneth? And is this something that the government in Singapore is focusing on already, or is there still a focus on daily infection numbers?
Well, I think if you look at the daily press releases that come out about twice a day, we have a top-line figure that's published that's based on the number of cases that are sort of reported for the day with a cutoff at noon. And then sometime quite late at night, we get a fuller press release with a much more detailed statement of where these cases are from. So, for example, yesterday we had 5 linked community cases. That means that it's 5 cases that we know where they came from. We know who are the people who infected them, for instance. And then we had also about 10 or 11 imported cases. And that number has really been at a steady state for Singapore for over the past year. And imported cases means they're either Singaporeans or residents coming back from overseas, or foreigners, for example, from countries that we still allow some travel from. So that press release actually has a very, very detailed breakdown of all the numbers, not just the top-line figures, which is what Australia is doing, but it also includes the breakdown of number of patients in ICU, number of patients who require oxygen care, number of patients who are recovered, that kind of thing. So it's a very, very detailed breakdown, kind of like a situation report. And in the early days of the pandemic, last year, I think that was something that people kept a very close eye on, because any increase in cases basically told you how likely, in that sense, it was going to spread to the community, which is really the concern for everybody in any country in the world. But right now, I think that shift towards just tracking intensive care numbers, patients who need oxygen support, that's going to be looking at, like they said in the article, looking at COVID-19 more as something endemic, more than something like the seasonal flu, more like influenza. So it's kind of indicating that there is a possibility that you will catch COVID-19, but the possibility that you will fall sick, very seriously sick, and die from it is probably already going to be quite low with the vaccination rollout in the country and with all the precautions in place.
Yeah, that's the key point, isn't it, Gwyneth? We know a lot more about the virus, of course, now than we did just over a year ago. But even then, it was really only a danger to the vulnerable groups, and we know who they are. We've been very lucky in that we've got vaccines available quickly. So once the vulnerable are vaccinated and you're starting to get more widespread vaccination, we can actually live with this disease, and the drawbacks will be very, very minimal. That's the aim. I'm glad that your government has enunciated a clear path to that. Give us an idea of your vaccination rates at the moment across the adult population.
Right. So we're looking at about a number of about 36, 38%. So hovering just over a third of the population has received both doses of the vaccine. So that means they're fully vaccinated. And then we have about 60% who have received the first dose. So generally, in terms of our national target, we are looking at 2/3 of the population to receive the first dose by early July. So that's really right now. We're a little bit away from that right now, we're hovering around 60%. But we should be getting there in the coming days. Just yesterday, in fact, or a couple of days ago, the government did say that they were going to make bookings for the permanent resident population earlier in order to keep the momentum going. And we're really hoping to have 66% again, so 2/3 of the population receive both doses of the vaccine by August 9th, which is our National Day, which I think they hope will be some sort of a morale booster. And really the whole aim in that is so that, again, if you have the vaccine, the statistics actually do show that the effects are not as bad for you, and also you're less likely to pass it on. And that allows us to shift the entire way that we deal with the virus. So right now, what we're doing is that whenever a case pops up in the community, the government spends a lot of money, a lot of resources testing everybody around that patient, and then trying to isolate and ring fence, identify all the cases around that patient, and then isolate them and quarantine them and keep them away from the rest of the community. And that's really because you don't know how far it's going to spread, especially with the new variants, which we know, transmit a lot faster. But with a higher vaccination rate, you could basically have people recover at home because their symptoms are going to be less serious. And then if their family members are also vaccinated, there's less chance that they'll pass it to them, and there's less chance that their family members are going to get it from them. And generally, it will just be, something that we can live with a little bit more normally. We can have big events again. We can have sporting events again, big sporting events. We are looking at hosting our National Day parade again this year in a mass event, of course with fewer spectators and with entirely vaccinated as well. But at least that can come back again. And also something that a lot of Singaporeans are looking forward to is travel, because we have no domestic travel whatsoever. We're a very, very small country, as you might know. So a lot of people are also looking forward to international travel. So when you have these things in place, hopefully that means that we can go overseas, come back, and we have much less quarantine, or better yet, no quarantine.
Well, let's hope we can get our travel bubble open with Singapore soon, Gwyneth. Thanks so much for joining us. Gwyneth Tao there, who's a senior broadcast journalist with CNA in Singapore. And they're showing us the way. They're ahead of us with their vaccine rollout. And they are showing us the way, though, by clearly outlining to the public what the markers will be and how that country will live with COVID, something we have to do in this country.